Hello, caught me by surprise. Hi, everybody. Good afternoon. Michelle Cordero, Education Director here at ASIS Massage Education. And it's been a little while that I've done a live stream, but I've got a bunch of great topics scheduled for the hopefully in the next few weeks. I got a couple of holes I'm trying to fill, but we have a lot of great content to cover. And I thought we'd start with coming to something that I'm really enjoying working with myself and talking a little bit more about manual lymphatic drainage, in particular with post-operative care, post-plastic surgery in particular. And so my guest today, we'll talk a little bit more, I'll bring her on, but just so you know, we actually went to high school together a million years ago, and from my hometown, and we just happened to pick the same field to be a part in, and but she's doing really cool things in the post-operative world. So I'm going to bring her on. Her name is Amanda Alvarez, and let's bring her on and say hello. Hello.
Hi.
Hi, thanks for coming on and chatting with our students and everybody else out there in the interwebs land. So I was mentioning that we did from the same hometown and did go to high school together. And our families are. We also have a Costa Rican heritage as well. I always thought that was cool that we had that in common.
Yes.
And then being friends on Facebook, like most of us are with, people we went to school with. I saw you were doing massage and particular with lymph and everything. So I was like, hey, look at all this happening. So why don't you tell us a little bit about your story and how you went from well, I guess how'd you end up kind of in Florida too, but how did you pick massage and then we'll get into a little more how you got more specialized in doing the work that we're going to talk about today. But how did you get in the industry to start with?
Well, when I moved to Florida, one day I woke up and couldn't walk, and I had my first appointment to a chiropractor. And at that time, when I was married, my husband's at the time insurance covered massage. So I had my very first massage at that time too. And come to find out, the girl that my first massage therapist I ever had, she was the one who was telling me how great it was. And I was like, you know what? I want to do that too. And I did. I worked full time and went to school part time. And here I am 20 years later.
Yeah. Well, what were you doing for your full-time job, if you don't mind me asking?
Oh, I was working at a hearing aid company, which I was there for 13 years too. So I know a lot about hearing too.
Yeah. Oh, very cool. Oh, it's so interesting. We have, I feel like a lot of our students that come through the doors, a lot of them have had experience with massage a little bit, and it made them feel like, hey, I could do this too. And I think it'll be fun, interesting. And then you have people like me who had never had a massage going into massage school, and just knowing I wanted to do it and having my first massage in massage school. So that was a whole learning experience for myself that I usually tell students about.
Yes.
Like, at least you're ahead of the game that you're going to massage people in massage school. So don't be me and be silly.
Right.
But yeah. So when you started, did you work more towards the chiropractic fields because that's where you were first introduced to massage, or what was your settings that you were working in?
I did. I worked in chiropractic for 15 years pretty much. And then during COVID, I realized I could do it on my own. But in between, I did work at a country club for 5 years, seasonal, because Palm Beach is very seasonal. And I also worked at a couple of high-end spas over in Palm Beach Island that were on call. But ultimately, being my own boss is the best.
Yeah, that's really awesome. And so now you're, we were talking a little bit about this. You rent a room, or you have a room in another.
Yes, I rent a room. Yes, I rent a room part-time at an acupuncturist, and I've worked a lot with acupuncturists working with chiropractic as well. So I finally found a space. I rent part-time, so this way I can see post-operative clients that I can't make it to their house for whatever reason it is.
Okay. All right. That's really nice. So you're doing a little out call then as well.
Yeah. Still, there are people who don't want to go anywhere. They want someone to come to them. So.
Okay. Do you
Yeah.
like that, or do you wish they all come to your office?
I don't mind the breakup in the day. You know, some days I'm fully mobile and some days I'm just strictly at the office and some days it's a mix of both. So it just depends on where, you know, the people fall in the schedule.
Okay. All right. It's a good way to look at it too, kind of breaking up the day and
Yeah.
adjusting that. So,
It's a
yeah.
lot of work on your body going from house to house, you know.
Mm.
I had back surgery back in August, so it was brutal doing that until I
Yeah.
had my surgery, taking that table in and out of the car.
Oh gosh, yeah.
Yeah.
So, did the surgery really help you? Did you have to have a lot of downtime?
Um, I had the least minimally invasive surgery, microdiscectomy, L5S1. But I had to be careful how much I was lifting for a certain amount of time, which I would say was about 4 to 6 weeks. I had to be
Okay.
really careful.
Oh wow. Wow. That could
Yeah,
be a whole other conversation about how we using our bodies and trying to fix it so we can keep helping people. Yeah. Absolutely.
exactly.
So what brought you into starting to think about working in the post-operative community? I was it something a certain client came in with and you're like, I need to find out how to help them, or is it just the environment you lived in? What were some of the reasonings that you were seeking this out?
Well, at the chiropractors I worked at for 10 years, the last one I worked at, there was a lady there. She's become a really good friend and my mentor. And I'm sorry, hold on one second. I thought my thing was plugged in and it's not. And I don't want it to
Oh,
die.
okay, no problem. Yeah, no sweat. It happens, trust me.
Okay, sorry about that.
That's okay. We didn't want to lose you.
There was a lady there that worked chiropractors, and I had already had like in a car accident. I had a slip and fall and all that. So she knew lymphatic drainage, and so during my accidents, she would work on me. She did a lot of lymphatic drainage because I had a lot of cervical issues, and the lymphatic drainage helped tremendously. You wouldn't think something so gentle would help, but it helped my neck a lot. So she got certified in the 90s with Vada International. And
Okay.
she had her class with Hildegard. And so she's like one of the originals of when they
Yeah.
came to the United States and taught lymphatic drainage for the first time. She was in that class.
Wow.
So she's been my mentor doing all this.
Oh,
And so that's how
good.
I got into lymphatic. Plus, I wanted to do something that was lighter on the body, but still effective.
Yeah, absolutely. So, were you in the beginning of your training seeing more like yourself experience like that let the neck help work, like something like that work, or were you already seeing a lot of the post-operative people coming in for services?
We didn't get any post-operative people at the chiropractors. After I got certified was when I really started doing the post-op, and only because of my own journey with plastic surgery, I knew how lymphatic drainage, would help me personally
Yeah.
and other people, not just post-surgery, but just like everyday things too. You wouldn't think of.
Right. Yeah. So let's chat about that a little bit because I feel like right now I know because I'm following pages that I'm interested in, but I feel like I see a lot of conversation about using lymphatic drainage in two main areas, working with postoperative and then oncology patients as well. People living with cancer diagnosis. And I don't think as many people are aware of other ways that they could be benefiting from this work. So, what are some of the ways that you see great success within your practice?
I actually was giving massage to a lady. She was 104, and her current lymphatic drainage therapist had a shoulder replacement from doing too much deep tissue. She ended up having to have a whole shoulder replacement. And she asked me to take on this lady. And so I was just really doing gentle massage for her until, it was her last day. She ended up passing back in July. But I mean, it's so gentle, so effective. Everybody always just feels so great after having it. You wouldn't think the gentleness would actually give you relief, but it does. And I'm living proof.
Yeah.
I just had it this morning.
Oh, nice. So do you
Yeah.
get like a full MLD session, or do you mix it in with some more Swedishy type based massage?
The lady who works on me is my mentor. And so she comes and she always does my neck. Sometimes I do my stomach and sometimes I don't, because she also does active release technique. So she also helps me with certain things with that as well. But I do try to get it regularly.
Yeah. Oh, that's awesome. It's walking the walk that
Yeah.
you're talking. I love that. That's great. So you had
Yes.
mentioned too, from your own personal experience, you knew that lymphatic drainage was helpful for you. I was just listening to a podcast. I'm confused with all my things that I'm listening to now, but there was a conversation about how that there's not always a lot of information to the patients experiencing these surgeries about post care, and maybe not to the fullest extent that they could be. In your experience in working with your clients and what you're hearing in the field, do you find that to be true, that not a lot of people are as educated about what needs to happen after the surgery in order to help their healing?
Yes. Not only the doctors, but also the patients. Either they're just so unaware, like some people just jump into surgery and just don't do the research on what the post-operative care is supposed to be. And not only that, but a lot of people, the majority of the people that I see, they all say the post-op care, the instruction, the direction is almost non-existent from the doctor. Until they see someone like us telling them, okay, you need to do this, or you need, this is what we need to do. This is how long you need to do it, or whatever. And then you also have those people who are doing stuff that aren't lymphatic and they say they are lymphatic. So, you got to have to set yourself apart from these people, especially here in South Florida. I see it every day.
Yeah, I can imagine. What is like the regulations down in Florida about it? Is there the ability to kind of police this kind of these techniques and this like people who aren't licensed and things like that?
Yeah, I mean, I have so many things. I have so many things to share on that, but there's not enough time in the day. Someone recently just had their license revoked for doing incisional drainage that they said was lymphatic drainage. So here in Florida, they are taking people's licenses away, or they are being suspended with hefty fines. So, people go over to Dominican Republic, Latin countries, and they come back expecting to have this particular service. And when I have someone contact me, I have to ask them, what are you looking for specifically? Because I don't want to be a part of that. And I don't want them to get the wrong idea and then not be satisfied. So I just try to weed those people out. Some people I can change their mind and tell them and give them the proof why they shouldn't be doing something like that. And some just still want it because they see the instant decrease in fluid,
Yeah.
So.
Yeah. So for those who don't really understand this, can you explain a little bit like what's the reasoning behind? I know you mentioned a little bit about decreasing the fluids, but what happens after surgery that makes this a need for people to seek an incisional drainage out and what they think they're doing?
Well, over in Latin countries, they see the fluid coming out. So of course they see, instant gratification that their stomach has gone down, but you can still see that with manual lymph drainage, Botter technique. You don't need to, squeeze the fluids from the incision hole. I mean, your body has already been in a trauma state, and now you're creating more trauma with doing that. And not only that, it makes your body swell up again, like within a few hours, and then your body feels like it needs to be drained again because you're bypassing the lymphatic system, pushing it out. You're not absorbing it, you're not secreting it out, so people start to swell up again. And this is coming from like people who have been to DR, where they say they come like maybe 2-3 times a day to drain these girls this way, and it's painful. It's painful too.
Yeah, it's an open hole that just got surgery on, and it's all that it's fresh.
Exactly. And some doctors, even here in Florida, even in other states, and a lot over in Latin countries, they'll leave the lipo hole open so that people can push the fluids out of it purposely. Wow. And then not only are you doing that, but then you open yourself up for infection because you don't know like what's in the air where you're doing this. Like people are doing it in hotel rooms and making a mess of hotel rooms in Miami. And Miami is telling people, if you're coming here for surgery, you can't stay here. Like, because they've been leaving a lot of damage to the walls, to the carpets, to just like everything with the fluids and the blood and all that.
Yeah.
So not only are you having a risk for yourself, but you're also not disposing of biohazard materials properly.
Right. And then putting other people at risk too that have to clean the room.
Exactly.
Ugh,
exactly.
Yeah, not good. Yeah. And then the other thing too, the podcast that I was listening, I'm remembering now what the podcast, I was listening to like 3 in the last couple of days, but I remember now too with what people feel that they're accomplishing with the incisional drainage. It's kind of almost like you had kind of alluded to too, like it's almost that addiction of like a pimple popping where people like to see like that reaction to happen, and it makes it feel like something's happening. But we're also forgetting that there's a reason you have fluid in there. It's not just like random fluid. It's fluid with healing properties in it that are there to repair the body. And so you need it there. Like, I mean, right?
Exactly.
Yeah, I know.
Exactly.
It's wild to me.
And one of the other things that I've noticed too. I'm sorry?
I said it was wild to me.
I'm sorry. Did you say something?
No, I'm good.
Oh yeah, no, believe me, girl, I have seen it here in Florida. I mean, it's the wild, wild west down here. Like, and some of the things that I noticed, the people that do this stuff, their lipo holes tend to heal bigger. Like they're more pronounced once they start to heal, because it's like when you're pushing the fluid, you're like pushing it out of this hole. So then it seems like the hole is getting bigger. And then when it starts to heal, then the hole is actually more pronounced and noticeable that you actually had something there. Like you had lipo, you could see, the scar there, instead of just leaving it alone and not creating any more trauma to the area. You have the healing issues too. So
that's just, it's too much. What do you see in your practice with more common types of plastic surgery recovery?
Like, what do I see the most of?
Yeah, like what are more common procedures?
Probably tummy tucks. Mainly tummy tucks is what I see. It kind of goes in waves though. At one time I had quite a bit of facelift clients at one time. And right now I actually have a girl who came from Dominican Republic, and she had chin and neck lipo and buccal fat removal. And she herself did pay for 5 incisional drainages over in Dominican Republic. And she said she couldn't finish them because they were very painful. And when I saw her, she had quite a bit of fibrotic tissue under the chin from whatever it was they were doing.
Oh, wow.
Yeah. Oh. But by the time she left, it was 10 times, 100 times better than when she came in initially.
Oh, that's so great. And how many sessions did it take for her to see results?
Well, I've only seen her once this week because she just came back. But she wasn't that bad. Some people, I just kind of like to play by ear because some people need more than others. Some people heal a lot faster than others, and some people need more sessions. You know, I had a lady who had Sonobello, AbX, and by the time I saw her, it was like she was like 2 weeks. And when I looked at her stomach, I said, "What happened?" And she had a hole in her stomach in the incision. And I was like, "You need wound care. Like, this is not good." Like, it was a gaping hole in her stomach.
Oh.
And of course, the doctor wasn't happy about it because, of course, they want to be the one to, you know, fix it or heal it or whatever. But I did find her a wound care clinic here locally because she did have it like in Fort Lauderdale. We're in Palm Beach, you know. And that was back in November, and she still has somewhat of a hole. It's slowly closing, but, you know, she still had an issue.
Oh, wow. That's incredible.
Yeah.
But I can imagine too, there's probably, you know, a lot of horror stories or challenging recoveries, but there's probably ones that, and like in my experience so far, I've only seen reasonable recovery in mine, but there's probably getting, and you probably see a lot more of that, I would guess, right?
I see a lot of what? I'm sorry, you cut out.
Oh, I'm sorry. Sorry, the connection's kind of funky today. So you probably see a lot of like more like textbook recovery cases that aren't very.
Yeah. Like I said, it goes in waves, but typically, you know, you have like 10 sessions and they're pretty good to go. Some don't maybe need as much, and some maybe need a little bit more. For the most part, there's not anything crazy going on. You know, you do have a few of those in between, but for the most part, you know, you do your thing and they feel better once you're done, and, you know, you wait for the next one to come along.
Right.
Yeah.
So you mentioned people who are doing things that aren't, you know, licensed or certified in better techniques or modalities in the work. What do you feel? What kind of knowledge do you think is important to be able to work with this population? And is knowing just general lymphatic drainage enough?
Well, I mean, you definitely need to be certified because there's a lot of people saying they're doing lymphatic drainage, and it's not lymphatic drainage. It's either incisional drainage or it's what they call Brazilian lymphatic drainage, which is more of a sculpting type of massage. And which shouldn't be done post-operatively after a plastic surgery, because that's way too aggressive for it to even be lymphatic. And you don't want someone like pressing on like a tummy tuck or something like that, doing anything crazy. But oh my goodness, I forgot what I was saying. What was the question again?
I know, go fired up. What kind of knowledge? What kind of knowledge?
Oh, yes. You definitely need to know some myofascial and scar tissue release stuff because you know, some people just naturally create fibrotic tissue, and some people come to you with fibrotic tissue because of what they've already had prior to coming to you, and now you kind of have to fix it. So you need to know those two things are two important things to know after you know, plastic surgery. Hopefully you won't need to use any of those and you're just doing lymph drainage. But you definitely need to know some myofascial scar tissue release things to get things moving along.
Yeah. What about if somebody comes in with like I'm thinking like a BBL, for example.
Okay.
I can imagine there's a lot more that has to go into positioning challenges. Can you talk a little bit about what you would need to do for somebody post a BBL surgery?
I use 2 half bolsters with a couple pillows. And so I kind of have the one bolster below the low back and one right underneath the glute area to kind of keep it like floating. And this way it's not touching the table and they're still comfortable, because so many of these girls are laying on their stomachs and their backs are bothering them too. And you have to do the stomach when you do a BBL. You have to, that's like the main hub. You need to do the stomach when you're doing a BBL. And it's important to know not to touch the BBL too when you're doing these services.
Oh, wow. So for those who don't know, what is a BBL? What does somebody undergo when they get one?
A Brazilian butt lift. So essentially, they're just doing, most do 360 lipo, and then they just re-inject the fat into the glute area. And you know, it all depends on how your skin is too, and how much fat you have. Some people have to gain weight, and some people just take it from what they already have.
Yeah. That's where we come in handy when we have some
Yeah,
extra.
right.
I love that. Yeah, it's I see the recovery for the people, and just that thing you brought up about them having to be on their stomachs so much. It just sounds so hard, the recovery part of it, that it's got to be a big challenge.
Yes, especially, doctors shouldn't be allowed or shouldn't want to do a BBL with a tummy tuck. It's just you, and I've seen people who have done tummy tuck, lipo, BBL, breast implants all together, and it's a rough recovery, very
Yeah.
rough recovery. You can't lay on your back, and you can't lay on your stomach.
Oh, it's like even the side, so that's got to be hard too, because you have to be supporting all the joints, and like I don't even know, how do
Mhm.
you drive home after the procedure? I can't wrap my head around it.
Exactly. Exactly.
I did actually, I saw a video of somebody, they were like, they had gone to one of those clinics where it's like they bring you to the medical suite afterwards for recovery, and you stay there for a little while, and they have like the nurses, or I'll put nurses in quotation marks, because they're not always certified or licensed. But they basically had like a big van, and with a big mattress in the back, and they just had people like get in there, and that's how they transport them, because they couldn't sit and put on like a seatbelt, and like they just can't do
Right.
that. So like, wow,
Yeah.
it's really really mind-blowing to me. But at the same time, like I'm not putting judgment on it, because it's more about us understanding what the people are going through to be able to help them, because they need recovery and they need help as well. So
Exactly.
mhm. Do you find some people might be embarrassed that they did this, and maybe are a little hesitant to ask for help for recovery, because they don't want people to know they did it, or just have a little even buyer's remorse on it at all? Or what is your general feeling about, I guess, the attitude towards getting procedures done?
No, I really haven't come across that at all.
Mhm.
And the thing is with that is, it's the people who are in kind of like in that situation are the people who haven't had the guidance on what they need to
Mhm.
do
Mhm.
post-operatively.
Yeah.
And like I said, some of these doctors don't believe in the lymphatic drainage after surgery, and some just aren't just aware of it, and so they don't know what to tell these patients, and also the garments afterwards. Some of these doctors know nothing about the proper garment,
Wow.
that they should be wearing.
Yeah. Oh, that's really interesting to me, because you would think that they would like send them home with that, or, fit them for a special garment or something, but it's not always the case, you're saying.
No, it's not. I mean, obviously, when you're done with a tummy tuck, they give you the binder. So after
Mhm.
the binder comes off is when they typically will either give you, a faja, or some just won't, or they'll give you like a Spanx, which is definitely not enough support.
Mhm. Yeah. Yeah. Oh gosh. I have so many thoughts and idea like questions about things, for sure. And then you live in Palm Beach, Florida, where this I it sounds like there's a lot of plastic surgeons, and a lot of people, it might be even the norm that somebody who's had something done. Is that the case?
Yes.
Yeah.
Yeah, yeah. I mean, I mean, people that live here and people that are traveling here, it's everywhere down here.
Yeah. And why is it just that there's more doctors that way, or is it a lot of good
Yeah.
deals?
I mean, Yeah. I mean, you go to Miami, there's like a plastic surgery center like everywhere. There are so many plastic surgery centers, so many doctors. And since we're so close to a lot of Latin countries too, a lot of them do. And if, some doctors come from Latin countries and come to South Florida to work, so it's everywhere here.
Yeah.
And some of the prices scare me because, I don't know. You can go get a
Yeah.
BBL for 3 grand.
Yeah.
It
Bring in your
scares me. The
coupons.
price
Yeah.
scares me.
Yeah, that's it. Yeah, it makes me a little nervous. So I know here
Yeah.
we're in Arizona here. So I know a lot of people going to Mexico for procedures. And so I find a lot of times we're seeing more people who come back to the States here and need recovery time because it's very quick turnaround when they go into Mexico to get it done. And they're back here very soon and they still have a lot of swelling and a lot of recovery to do. So that's what I've been seeing more of.
Yeah.
Yeah, but then we also we're Scottsdale is pretty has a lot of places too here. So there are also that people are getting it done here. It's not like it's just Florida or like Miami
Right.
area for sure.
Exactly. I had a friend go to
Mhm.
Mexico and 3 times and came back. I had and then I had an older lady. She was 75 and went to
Mhm.
Cancun. And she had been
Wow.
to Cancun for like multiple procedures. She looked
Wow.
good though. The doctor did
Yeah.
good.
Yeah. That's really cool. I don't think I'd be able to tell. I'm not very good at that yet with I know when people can look at somebody and it's like, "Oh, I know you got this done," or something like that. And
Yes,
I
I
guess I don't pay
can.
attention that well to know that well, but it's such an interesting it's very new to me actually. So I started with the lymph work just a couple years ago. And with that coming along with the plastic surgery understanding as well. And so it's the only because of lymph that I'm learning about plastic surgery because it's not I don't wear makeup. It's not really my thing. It's not
Yeah.
a me personal thing. So I've just been really amazed by the industry and really excited that I can be a part of it in my own way now with working with lymph and helping people recover. So yeah. I had a guy the other day I was working with, and he was going on a plane ride, and I was like, "Oh no, he's gonna come back. It's all destroyed." I was so worried about that, but it was fine, and
Yeah.
he was healing quite nicely. So he was, but I think in general, like you said earlier, having different body types and people heal differently, and they experience the surgery differently. I think, even without lymph drainage, he was going to be doing okay. So it was a nice little boost for him to heal up that much quicker for that. So,
Yeah.
um,
Yeah,
yeah,
for sure.
it's really
And that's when the
fascinating.
garment comes in handy too.
Hmm. Yeah, I think people. I know since I've been working here with ACOLS and learning more about the lymph system, I wear compression socks a lot more, and I for myself know like when I need to put them on, and it's been a long day or whatever it is, and knowing how much. Uh, Understanding how they work, that's the other part of it too, is and then understanding the anatomy and the physiology behind the lymph system. It's just fascinating to me. And so, yeah, I have to have all my socks now to wear. Yeah.
Yes, the compression socks are very important, especially
Yes.
after surgery too. And even if we do a lot of standing through the day, people don't
Hmm.
understand. And if you did have surgery, you need to be wearing those on the plane if you're coming back from somewhere, or if you're
Yeah.
traveling soon after having surgery. That's
Hmm.
important as well.
Yeah. Yeah, exactly. Um, I forgot what I was gonna. Oh, because I brought up ACLs, so that was another reason why I asked you to do this conversation with me. Is that I wanted to highlight that you are a fellow ACLs graduate, and that's for those watching and don't know, that's our sister school, the Academy of Lymphatic Studies. So um, I guess, what do you think about ACLs? On the spot,
Yes.
you're on the spot. uh, but
I loved my class. And of course, anybody who knows Marina loves Marina. And, she's helped me tremendously, and she knows my journey. And, I've had a long journey with plastic surgery. I started off with a mini tummy tuck, and I still had a lot of loose skin, and I had to have a revision. So, so I've had more than one. And so Marina knows my story with that. And the second one went pretty smooth. And she actually uses my video in the post-op training that I took with her as well. And I think it was Laura that was in that class here in Palm Beach Gardens. I did the post-op advanced class.
Yeah. And we thank you for that. Having that content for other students to be able to learn from is really, really helpful. So thanks for supporting us with that. Yeah, that's really great.
Yeah, no, I love the school.
I keep trying to talk you into maybe teaching for us someday, but now everybody's watching. Now you're on the spot.
I would love to do I don't know if I would want to teach like all the time, but I would love to do like a teacher assistant if one is needed at any given time. I'm open to that. So just putting that out there.
All right. I'll put it up to the higher ups to let them know. So for sure. Yeah. So what would you say to somebody who's a student right now in massage school? Like they're just getting into the field. What would you say to them to maybe, I don't know, convince them to go look into this work or think about possibly any pieces of advice or things to find out for themselves or why should they do this?
I mean, lymphatic drainage is good for anyone and everyone for any situation. It doesn't have to be because you're in pain, because you had surgery, it's just good to have every once in a while. I tell people, you know what, you should do this. Like if you can't do it once a month, do it a few times a year, something. You need to get your body's lymphatic system moving and operating and staying clear and draining. It's important that we don't have clogged lymph ducts and stuff like that. And and as a massage therapist, if you want to have longevity, you need to have something that's not going to be so hard on the body every single day. And that was the reason why I ended up getting into it. And plus, I just saw the results for myself personally, how good it was. Not everybody likes the light touch. Like as the clients, I've had some people tell me, I don't really care for that, whatever. So it all depends on the client too, of course. But you can really use it in almost any situation. I don't know where I would be if I didn't have it.
Same. It has elevated my Swedish based massage. I add in pieces of it into every session. And the anatomy understanding that I got from learning through ACOLS just really elevated my understanding of other parts of our system and understand how everything works together. So it was really life-changing for me when I took it, because I was resistant for years. I'm like, this is weird. It's light. It's not my thing. And I was just like, okay, I can do this light stuff because it's not boring. It's like so interesting to see. You can visibly see results. And it's pretty, what was it? I was going to say, satisfying. There we go. I don't know why I couldn't think of that word.
Oh, yes. It's very satisfying, especially when you start doing like the profundus and everything, and you start with that, and then you can start to see that they're already swallowing. It's already activating. Things are already starting to move. And even if like you have a neck injury like me, or I'm working on someone who has a neck injury and you got to get deeper, I always do the lymphatic in the cervical area so that I can move things along so I can see what I'm really working with afterwards. So.
Yeah. Beautiful. I love that. That's so great. Yeah. That's wonderful. I'm trying to think anything else. We covered a lot of information here and trying to let our students, our viewers know a little bit more about what the work is, because I think not everyone understands it. And like we talked about earlier, there's just so many other things that people call what they're doing lymphatic drainage, and it's not quite the same. I mean, there's different schools that do good work, but
Yeah.
yeah, it's great to have that education.
Well, no, of course. And also there's another thing too, and I'm sure you've seen it. There's a lot of people offering lymphatic drainage classes that are only a day or two long. It's not enough,
Mm-hmm.
not
Mm-hmm.
enough to help anybody
Mm-hmm.
post-operatively.
Yeah.
I took one before I took my ACOLS. I took one, I think, like a year or two prior to that. And
Mm-hmm.
I literally was lost.
Mm-hmm.
There's no way. It's a good introductory, but
Mm-hmm.
you cannot take a day or two class in lymphatic and know what to do, how
Mm-hmm.
to do it, treat
Right.
someone properly. Because if you don't know how to drain post-operatively after a tummy tuck, and a lot of these people who are saying that they're doing lymphatic drainage are like pushing into the tummy tuck incision, and that's only going to make someone swell even more. They have no idea that you need to route up,
Mm-hmm.
you
Mm-hmm.
know, and
Yeah.
that's how you know that these people are not properly trained.
Yeah. Yeah. And so speaking of this, made me think of this too, being properly trained costs money.
Yeah.
And so it's a challenge. I hear a lot of students like, oh, this was really fun. Like, because we have a shorter version of our class in our entry level program. And a lot of them will say, okay, I'm ready to take the 40-hour course. How much is it? And I give them the price. And our students do get a discount because we're sister schools. So they even have with that discount, they feel like, oh, that's a lot. But I said the investment into this work is going to be so great for you in the long term. So do you feel like that investment came back to you easily through what you're charging your clients?
Oh yeah, with the first post-op client I had, paid for the class.
Wow. Wow.
You
That's,
know, she had more than 10 sessions.
mm-hmm.
So I
Yeah.
mean, and that's another thing too, is because a lot of these people who are not trained, like legitimately trained, they
Mm-hmm.
are charging well below what a real lymphatic drainage therapist would be charging,
Mm-hmm.
a certified
Mm-hmm.
one. And
Yeah.
you have to set yourself apart, and you do get some pushback and saying, oh, I so and so blah blah blah. I'm like, okay, but I seen their Instagram page and I see what they're doing, and they're not doing it right. I'm going to tell you
Yeah.
that right now.
Yeah.
I'm pretty honest with people when
Mm-hmm.
they say stuff like that. I'm like, okay, well, do what you want. Like, I had a girl reach out to me, and she specifically asked if I did incisional drainage. I told her no. And then she reached out to the colleague where I rent my space, who does lymphatic drainage, and she doesn't like to do BBL. So then she referred her to me, and I'm like, I think this girl just reached out to me on Instagram. And so then I spoke with her, had the
Yeah.
whole conversation to her about it, and she still went and found someone who wanted to do the incisional drainage. So
Mm-hmm. Yeah. You can only do so much.
you can,
Yeah.
yeah, exactly. You can only do so much, and that's the reason why I ask specific questions when I get inquiries about it, because I don't want someone to come in and say, this is not what I paid for.
Mm-hmm. Yeah. That's really smart. Yeah, having those conversations. And then I've wondered too, for some people, they're putting the surgery on their credit card. It's not really, some people have the extra finances to be able to cash pay a lot of this stuff, but do you see people being resistant to how much drainage or lymph drainage they might have to do because they're saying, oh, I put all the money into the surgery, I don't have money to pay for the post-op? Or do you see more people rolling that into the total cost of what it's going to cost them to do a surgery?
Yeah, that's a good question. There's a lot of people. It's both. There are
Mm-hmm.
people who literally will just do the surgery and not consider any post-operative care, whether it be supplies and your garments and anything else you may need if there's an issue with something and you need another expense. But there's both, and I tell people you need to set aside at least $1,500 to $2,000 extra in post-op care and supplies, because not only that, but like when you are draining, your faja is going to get bigger. You're going to need another one, so that's going to be another expense. You need lipofoam pad, maybe an ab board, there's all these other things that you need. You have to consider that as part of your expense for this surgery. And if you can't do the proper lymphatic, I always say, don't do nothing at all. Just get your faja and wear it. But don't go do incisional drainage. Don't go and doing anything crazy. There's a lot of people saying that they that do cavitation after. You don't want to do cavitation either after surgery. So many people are getting that from their post-op provider who is not legitimately trained. And so they have no idea that they shouldn't be doing cavitation. Why are you doing cavitation when you just had surgery?
Yeah.
It makes no sense. You just had you just had tummy tuck. Why are you trying to melt more fat? It's creating fibrotic tissue. It's creating other issues. So
yeah. Well, the education that we have to get out there for sure.
Yeah, that's exactly the thing.
Yeah. That's what I'm appreciative of. I know you're on social media educating and, trying to get people that information of what the differences are and what they need to do for themselves to make educated choices in their care.
Yeah, you have to. That's why you have, just like you research the doctor, you need to research the person who's doing your post-op care.
Yeah.
And I mean, I don't know in other states, but here in Florida, if you are advertising your business, you need to advertise your license number. And there's a lot of people that don't advertise their license number because a lot of them don't have one.
Yeah.
They just set up shop with their cavitation machines and, say it's post-op care.
Yeah. It's so scary.
And that brings up another thing. I had a girl last year. She went to this place not too far from me, and how she was draining her was that she put a needle lancet into her stomach and let it drain into the cup.
Oh my God.
How nice was that?
Oh my gosh.
And then I asked her, I said, well, where did she dump the fluid? And she said, down the drain.
Wow.
She paid for a certain amount of visits, and she said she just could not do it anymore. I said, you don't put a needle in someone, let it drain out and drip into a plastic cup, and then you dump the fluids in the sink.
Yeah. Wow. And this was what, a massage therapist or just a?
She's not a licensed massage therapist.
Oh.
She's a Colombian girl in this area with her and her mom set up shop with their cavitation machines. And she's doing what she learned over in Colombia. Well, we're not in Colombia anymore. We're in the United States, and you can't do that.
Yeah. Yeah.
It's so out of the scope for a massage therapist.
Right. Yeah. But you're saying she's not even a massage therapist. So
no,
it's no one can police her really what she's doing.
And that's the thing. A lot of times people do make reports to the board. And if you stay anonymous to the board and the board has a question and you're anonymous, there's nothing more they can do because they don't have anyone to contact. And so the only time the board will do something is if someone has reported them, like the patient themselves has reported themselves to the board. And then the board starts to investigate because the patient is the one saying, hey, I'm the one. You can come ask me any question you want, whatever. Yeah. But if it's a therapist reporting it and they decide they want to stay, anonymous, then a lot of it just stays in limbo.
Oh, yeah, it's scary. Here in Arizona, we have challenges even we're very short staffed in our board. And so there's really no policing of things that are happening because there's just no resources to do it. So things that are even more challenging, which is a whole other topic and a whole book with challenges with trafficking and other things like that and illegal practices. And there, not a lot can be done. And so this is just another part of something that the best weapon I think we have is education.
Exactly.
Because it's the only thing we can do. We have very limited in what we're allowed to do and what power we have.
Exactly. Exactly. And not only this, I don't know if you have an issue with this out there, but also recovery homes, illegal recovery homes.
No, not
There
here
have
so
been
much
so
though.
many
Yeah.
raided in Miami. Like some of the stories that come out of the ones that have actually been caught are like insane.
Wow.
If you put in Miami recovery home on Google, whatever, I'm sure you'd see a ton of stuff where police have raided homes. And it's because in order to be a legitimate recovery home, I think you have to have like an assisted living facility license.
Mm-hmm.
And a lot of people have actually lost money on giving deposits and paying full things because they paid it to someone and then they're no longer in business and they just kind of like took their money and ran. And there's no recourse because nobody has a license or anything like that. They don't have insurance policies, things to protect the consumer.
Right.
So,
yeah. Oh, so the moral of the story, they need more of us to go out there and do the right thing to help people. And we need to educate the potential clients and help people with, get that healing to be able to make it worthwhile. I would hate for someone to go get spend thousands of dollars on a surgery, and then they don't heal well and something happens and they have to do it again, or it doesn't look how they wanted to. We want their investment to make sense to them and to feel good to them.
No, of course. Believe me, I know. I mean, I've seen enough to know that, I mean, people really need to research the doctors too. You may see something good on Instagram or Facebook or TikTok or whatever, but the doctors always show their best work.
Mm-hmm. Right.
So
yeah,
you need to really investigate the doctor, see if they're board certified, check any lawsuits or anything that's come against them. I've seen some of that too, and people are just, basically deformed now,
Yeah. It's really sad. But but we're going to help everybody that we can.
Yes. I always say, educate yourself, do your research, do everything you can. If you're going to see a doctor, you should have like 3 or 4 consults with a doctor, with, different surgeons to see, what the best route is for you when you're seeking plastic surgery. Don't just go with the first doctor.
Right. Yeah. Smart advice.
Yeah.
Love that. Yeah. Well, I know we're running at almost about an hour now, so I don't want to monopolize more of your time. But was there anything that we didn't mention that you wanted to make sure you were going to let people know about? I know we talked about a lot of things.
Yeah, I did see something real quick the other day where someone on Instagram somewhere, they were saying something about the fajas, and people have to realize you're not to live 24/7 in your faja after your recovery phase. You don't want to wear your faja, well past your recovery phase.
Yeah.
Because you don't want your internal organs to become weak. And so, though the proper garment is important, it's also important not to become dependent on it.
Yeah, that's true. Yeah, all the more reasons for being educated on that post-operative care and to have good medical team and support system to make sure that you get that. Yeah,
of course. Yeah, of course. Yeah. And don't wait till the last minute either. To schedule your post-op. Don't wait till, I just got it done and now I need somebody tomorrow.
Right. Because people like Amanda are booked out and they need to get in. So yeah, it's important. It's true. When your surgery is, you can schedule your post-op care. So
yeah. And another quick thing too. I know some people are quick to have it the next day. And I tell people, if you want to, yes, you can. But if you want to wait a week, it's fine. Like, it's not going to deter your healing to wait a week and then start your post-op care. Some people want to start the next day, and I'm like, well, let's just play it by ear, because when you have a tummy tuck, sometimes you're really not moving until like the day 5, and it can be a little challenging to get on the table and get moving around, because I know personally.
Yeah, especially too, we forget the body is healing itself. It's just we're facilitating that a little bit to help it heal a little
Exactly.
faster. So it's doing its own thing in the beginning too, that it's not like they're not doing anything. So that's, yeah,
Exactly.
good point.
Exactly. Yeah.
Yeah, for sure. Oh, wonderful. Well, on that note, I just wanted to give a big thank you to you to come on and chat a little bit about your experience working in post-op and MLD. And we got a lot of information of how people can use that and open up to a whole population to enhance their practice. So I really think, and it was great catching up
Yes.
with you, of course, in a professional way. But
Yeah, that was
we'll,
so fun.
yeah, that was really, really fun. So great. So everybody else, we'll see you next time. Big thanks to Amanda out there in Florida. And we appreciate having you.
Thank you for having me. Appreciate
Yeah,
it.
of course. All right. Till next
Bye.
time. Bye.
Okay, bye.